Hi, everyone, and welcome to this episode of XRHQ Live. It is an absolute pleasure to have you all here today. I love that everybody is on time. We've got members attending on LinkedIn. We've got members attending on YouTube. It's great to see. We have a fantastic set of guests here with us today. Julie, Kris, and Michael, welcome to this episode. I'm so glad you could join us, and I am super excited to be chatting today with you about this incredible application of emerging technologies, particularly virtual reality and artificial intelligence, to take nursing training to that next level. So thank you for being here, first of all. Let's go straight to you, Julie. I would love to hear from you how this came about, because nursing training has been, I'm not an expert in it, but perhaps you can tell us what it was like before and what brought you to this position today in with Nightingale using these emerging technologies.
I would love to, and let me just say thanks for having me on. We're pretty excited and passionate about what we do at Nightingale College, and they used to say that necessity was the mother of all invention, and I'm convinced now that it is COVID. COVID was the mother of all invention. Prior to that pandemic, Nightingale's delivery model was hub based. So we would go into communities, usually rural, and set up, we would partner with a facility, a long term care facility, a hospital, some type of community facility, and set up a simulation lab and skills lab. And we would run those on ground pieces to our delivery model at the hubs, and we would have state boards of nursing and accreditors mandate a little bit of a ratio. So usually it was 8-to-1 or 10-to-1 students would come at their prescribed time. When COVID hit, we started noticing that all of those facilities were shutting down, because that's what happened. And we originally thought, well, we started having that experience about 6 weeks left in our semester. So we were like, okay, 6 weeks, how can we get through this next 6 weeks? So my team and I took everything that was on ground and converted it to online. Our main goal at the time was to keep the learners, the students, progressing. And we wanted to make sure that they got through the semester. We didn't know that it was going to last, another year before we were going to have these facilities start opening up. So I called in every favor I could, every vendor that I'd ever worked with, vendors that didn't know me yet, and just kind of started trying to figure out, because I knew that we could use simulation to replace clinical hours. Nightingale is domiciled in the state of Utah, which allows up to 50% of simulation hours to count towards clinical. Not every board of nursing does that, but we can talk about that later. And so we did that, and we partnered with a vendor and got some 2D simulations going on, and we got through, right? And in the process of that continuing for the next year, we decided to do a pilot and to do the headsets, the Meta Oculus goggles. And so the first was an opt-in. We asked learners if they wanted to opt in. We're like, we'll give you a free Oculus if you want to opt in for this. And we got, I want to say it was like a 46% opt-in rate. And we did a pilot. And the initial results that we saw with the pilot were incredible. So we decided to extend the pilot, but make it mandatory for the next group. So everybody would get an Oculus and we would have them do VR. The initial results that we kept seeing were, we saw a huge spike. And then as we continued to use this, we saw a kind of even out trend. And we kind of decided, well, why are we outfitting all of these hubs with, big simulation mannequins which, are expensive. And so we would have to put at least one, depending on how big the hub was, maybe two mannequins per hub, when we could do it in the headsets. And, I brought this idea to the leadership group at large. And our CEO looks right at me and he says, okay, well, why do we need hubs at all? And that began the fundamental shift in our delivery model for how we deliver education. And it allowed us to go nationwide. It allowed us to, go from, I think we were close to 1,000 learners at the time. We're now at 10,000 learners that are using these headsets for their simulation activities. And that's how things went. We just changed our whole model to be able to offer this and grow at scale.
So what started as an experiment accelerated because of the success that you were seeing with it over the course of the last 4 or 5 years, inspired by the constraints of the pandemic, but has proven to be such a valuable solution that you've now implemented it across the board to your 10,000 students, which is amazing to hear about. And what about, yeah.
Go ahead.
Well, I was just going to jump to Kris and quickly ask him, Kris, how did you get involved in this? What's your history been? What's your story behind how you connected to Nightingale and the virtual reality industry in the first place?
Yeah. And thanks for having us here, Jeremy. This is great. My story is I was kind of brought on about a year and a half ago to help out Julie and Nate, the director of the team, build out this virtual reality team that we have. Because exactly as you're hearing from Julie, there's like so much growth happening, one in the VR space, and then also two at Nightingale. And just kind of happy to be here. And how I got here is a lot of my focus, my whole story is like I started out in entertainment for virtual reality, working at different studios such as Sony Pictures VR team or Fable Studio that did Wolves on the Walls. And my focus was as a designer there. I was also producing some of my own films on the side. And one of those films did well. We took it to Tribeca Film Festival and it was kind of like educational to me. And I wanted to really dive into that educational VR realm. So I got my master's in education from Harvard University, and the focus was on exactly that. It was on bringing VR into educational settings. And since then, I've worked at Striver, kind of directing lots of different actors on set for corporate training materials. And then am now here at Nightingale with the same eye of design for educational VR films, but kind of applying that into this healthcare education, specifically nursing education specialty that kind of Julie was talking about, right? So I think it's kind of the perfect merge of immersive technology, storytelling, and education for me.
And this is the beautiful thing about the technology, the fact that you can bring film expertise, video gaming expertise, storytelling, narrative design expertise to a field that feels initially on the surface like it is completely disconnected. I mean, nursing and video gaming and nursing and film, what has that got to do with one another? But once you think about a virtual reality training package and making that as effective as possible for the nursing community, then it makes a lot of sense. Out of curiosity, to everybody listening in, if you want to comment where you are coming from, so that could be the country you're in, the city you're in, whether you are in the nursing industry, the XR industry, it would be great to hear and get a sense of where you're joining us from today, and then we'll be able to pitch the discussion appropriately over the next half hour or so that we have. And but let's hear now from yourself, Michael. Thank you so much for joining us. You're the one person here who is the end user, the audience behind that is meant to be using the virtual reality and artificial intelligence application that Nightingale has created here. So would love to hear a little bit about your history, how you came to Nightingale, to using the virtual reality application, and ultimately what your thoughts have been so far, and telling us a little bit about that experience and what it's like. You're on mute. Sorry, Michael. I still can't hear you. I'm ready to jump on mute as soon as I can hear you. But if not, while you figure that out, I can also, oh, wait, I think we had something there. Can you say something, Michael? No, I can't. I still can't hear you. But I'll let you play around with it for a bit, and I'll come back to you. But feel free to interject as soon as you think you've got it sorted there, and we'll be right back with you. So, Julie, we'll jump back to you now, and I want to bring up a few pictures and videos to give the audience a sense of what this was like. So, the headset that you started with, was that the Meta Quest 2? Am I right in saying?
Yes, it was. Yeah.
And so this is the one that's displayed on the screen here.
Correct. A little bit bigger of a box.
Yes, exactly. Is that going to every single student now that is joining Nightingale College?
Yes, we actually are using the Quest 3 now. I think it's the Quest 3S. But yes, what happens is when a learner gets their, they enter their first clinical course, they get lab kits to do their skills lab stuff, and then they get their Oculus sent directly to them. We have a logistics department that works with different vendors to get these sent out. And of course, our marketing department got in, and we branded them so the Oculus actually say Nightingale College, and it's got a slick little skin on the box, so it looks really sharp. But yes, every learner gets a headset.
Fantastic. So this is, and you mentioned a different model that you were considering before, a hub model. Was that where you held all the headsets at a base location and then would send them out? Was that something you were considering?
No, we didn't use the headsets at the hub model. We were using Laerdal big, actually, mannequins that Laerdal actually makes. So each hub was outfitted with one or two of the big simulation mannequins that, people, big simulation centers and different things, different schools of nursing will use and have in their simulation centers. So what we did was we realized that we could have similar or better outcomes using the headsets. And so we did away with those mannequins and we replaced them with the VR headsets.
Brilliant. So you were always, from the beginning, sending out headsets to individual Nightingale students across the 50 states of the US?
Yes. Once we decided to roll this out full time, and we just kind of did a rolling introduction across the different courses, it became a part of their onboarding and their package that they get of supplies.
Thank you for that, Julie. And Kris, jumping to you. How do you deal with the logistics of managing all of these headsets? I mean, 10,000 headsets is a lot, particularly when you don't have an IT team at everybody's house. So how do you manage that?
Yeah, that's a good question. And I think it all boils down to how can we make the learner, the student, their own operations, like their own ops team, essentially, right? So then finding the support to do that has been this type of course, this like 1 week quick course that we designed that teaches learners, hey, this is like how to set up the headset, how to download the necessary apps that you might need, how to troubleshoot the headset. And we try to teach them that within one of the first weeks that they're learning in VR. And then also we have a really robust support team. Shout out to the support team at Nightingale that's always there for the learners, managing some of their tickets that come in. So yeah, I think it kind of boils down to that. Mostly the training them up, the classic motto of, teach someone how to fish that they can do that. That's what we try to do. And then we supplement that also with a good support team here that's always ready to answer questions and like work through bugs and troubleshoot as necessary with the students.
Fantastic. And Michael, it sounds from the background that we've got you back online now. Can you hear us, and can we hear you?
I can hear you guys. Can you guys hear me?
Yeah, we can
Yep.
indeed. Fantastic.
Were you picking up on my kid crying in the background?
A little bit, but that's fine. That's
Yeah.
absolutely fine. Thank you, Michael, for being here.
Yeah, of
And
course.
so, as we were saying, you are the only registered nurse here, the person who this application is aimed towards and geared towards, and you've been through it yourself, right? Can
Yeah.
you tell us a little bit about your story and what your view is on this technology, and whether you came across it before at all, before Nightingale?
So my experience, I kind of went straight into college, not pursuing nursing right away, but heavily focused on science. And so I had a lot of labs that I had to go to for my courses. And so that was a lot of in person. And then when I decided that nursing was a path that I wanted to go to, I went and jumped into an LVN program, or an LPN program, which is what it's known around the States. And in that, we did have a lot of skills labs that we had to attend and kind of do simulation labs and things like that. So then I got my license as an LVN, and I started working. And then COVID hit. And that's when I was like, all right, well, now let me take this time, because what I primarily was doing at the time, I was a school nurse, and a lot of the schools had closed down. So I had to kind of shift what I was doing. And so I started working at skilled nursing facilities, as well as at injection clinics for the COVID vaccine. And during that time, I was looking on how to pursue getting my RN. And there were some of my colleagues that I was working with at the injection clinic who were looking at Nightingale. And so I kind of started looking at Nightingale, and I saw that they were doing a virtual reality type thing. And so I quickly just kind of researched that on my own, because I've known about virtual reality. I'm heavily into video games, and kind of learning and doing things that are kind of tech savvy and tech advanced. And so I was really excited, and I was interested about that, and I reached out and started the process and started asking questions about the virtual reality like right away. And they were able to provide me with a lot of answers. One thing that was really exciting was that they would give you a virtual reality headset and provide all the software you need to kind of be able to run all of the programs that you need to. And then going through the actual program itself, going through the actual simulations was really fun. It was exciting. I enjoyed doing a lot of the procedures, a lot of the interactions with the patients. And again, this is far more advanced than what I was doing. But it was pretty similar. It was really fun to kind of see all the different things in real time that I was doing for these patients, and seeing how the patient is responding, whether it's their vitals, whether it was their physical approach to my kind of physical exam that I was providing to them. So it was really interesting to kind of have that simulation when, we were in the middle of COVID and no facilities were really taking students, or it was extremely hard to get into a place where you could learn these skills hands-on. And so doing the virtual reality Sims Lab was really helpful in that it provided that education and skill set that was very hard to come by during COVID.
Fantastic. Thank you for that viewpoint, Michael. And just to tell everyone who is on the stream here, thank you for all your comments. And if you have any questions at any point, please do write them in the comments. I can see them all coming in from YouTube. I can see them coming in from LinkedIn. So we've got Amory from Mexico. Welcome. Joanna, VR facilitator in London. John, immersive learning at Atlantic Technological University in Ireland. We've got quite a few people from India. We've got a CTO, Harsh, in XR development in Mumbai. We've got a few people from Tulsa, Oklahoma. Jerry, shout out to you. Vinay. Roger Kemp from the Netherlands in XR simulation training. So yeah, that's fantastic. I'm really glad we've got such a good group of people on the stream today. So what I'm going to do now is I'm going to jump to you, Julie, to get your perspective on how this has affected the nursing industry. So is Nightingale a unique user of this technology, or are there other colleges around the United States or elsewhere around the world that you're aware of that are using VR/AI technology? And then I guess the second part to this question is, has this impacted regulation and accreditation in the United States? Because I know you talked about simulation hours before. Does virtual reality count in that? Would be great to get your perspective.
Yeah, these are great questions. So to answer the first, I'm sure that there are many schools out there that use VR. I am not 100% certain that anybody is using it to the scale that we are, or in the manner that we are using it, at least in the United States. I know that schools, I've heard of schools that will use it to augment their existing simulation labs. So they'll have both the bigger mannequins, and then they'll have headsets, and they kind of do a swap. I am not aware of any other school that is doing it to the scale and the manner in which we are doing it. If there are people in the chat that want to correct me, please do. I would love to connect. I'm not trying to say that we are the only one, because I don't think that we are, but in my knowledge, that's
in fact, we might hope that there are many others using the technology to show its true
please
value.
enter these things, these things in the chat. Correct me if I'm wrong, or tell me that I'm right. I always love validation.
Either way, it's a win, because at the end of the day, we have either Nightingale is a very forward-thinking, innovative organization, or
I'd like to think so. Yes,
it's equally innovative, and a lot of other people are thinking about the value of virtual reality too. So I think we can't lose, really.
Exactly. The second part, that is such an interesting question, and one that I think is on the cusp. And we just did Nightingale Education Group, Nightingale College just did a big TEDx event where the theme of it was radical transformation of nursing education. As far as accreditors go, I think they are 100% on board. I mean, we've met our accreditation. Nightingale College has NWCCU accreditation, CCNE accreditation for our BSN and MSN programs, CNEA accreditation for our PN and our LPN to RN programs. We've not heard anything they've praised us for the use of it and the innovation that we're doing. I mentioned earlier that because Nightingale College is domiciled in the state of Utah, which allows up to 50% of simulation to count towards clinical hours. That's pretty unique. There's a couple other states that allow for it. We do have some states where we're not able to offer the program because they limit how much simulation can be used for clinicals, which is kind of concerning because we want our evidence shows, our internal evidence shows that across multiple years and programs, learners who engaged in immersive practice-based simulation showed significant gains in clinical judgment and readiness for practice. We have a nursing shortage, right? We need to be able to address this nursing shortage. We need to be able to produce more nurses. And so we need state boards of nursing to really critically evaluate that barrier that they're putting on the potential of having, and graduating nurses, so that we can address that nursing shortage. So that is a little bit of a difficulty. We would love to be able to offer, the program on, across every state. But we just, we find sometimes that it's not necessarily, and I don't want to correct, we are allowed to offer it in the state. I'm just saying that, nursing boards, to be an approved program in that state, they limit how much simulation can be used, which I think is really a detriment to nursing education. Because honestly, when nurses have that ability to practice and to fail forward, their competence grows, right? They become more competent. And when competence grows, they become more confident in what it is that they're doing. And then ultimately, as their confidence grows, nursing compassion is protected. They can be that compassionate nurse, which is why a lot of us signed up to be nurses in the first place, to be compassionate towards our patients. And so when they have that confidence and that skills embedded in who they are, they're able to know that and not second guess their judgments, and to be able to allow that compassion to come through as they work with their patients.
I couldn't agree more. Thank you for that, Julie.
Yeah.
And as you could see from some of the comments that are coming in, particularly thank you to Laura Kusamoto, Roger Kemp for giving us some other examples from around the world and in the United States in particular about how different organizations are using virtual reality within nursing programs. So Ohio
And I
State
love
University.
seeing that. I think that's great.
Which is amazing.
Yeah. And would be happy to connect and compare notes, Roger and Laura. It's wonderful.
Absolutely. Yeah. So please do. I mean, part of the point of running these XRHQ live sessions is really to bring this community together to learn from one another and help push immersive technologies forward. There is so much value that we can gather from them. And we're only hearing a snippet on today's episode in the nursing industry, but you can imagine how broad this value gets. So thank you for your comments, everyone, and keep your questions coming. So please add your questions to the comments and we'll address them in the last 10 minutes or so. But let's jump to you, Michael, because you've had some experience with getting your license in the United States, and can you tell us a little bit about that and how the VR experience feeds into that, if you can?
Yeah. So the state in which I got my license in was in California. And that's one of the hardest states to get your RN license. I think only New York and there might be one other that are up there with the difficulty of how to get your RN license and what's required with that. And when I completed the program with Nightingale and submitted my packet with all of my hours and grades and all that stuff, there was no hiccup. And so I think that just goes to the testament of how Nightingale has spent the time to kind of really focus how to apply this simulation to the actual nursing curriculum. Because, of course, we had in-person kind of classes where we had to go and provide hands-on at facilities and learn and kind of build those nursing care plans and work with patients, with real actual patients. But there was a good aspect of the time too, where we were doing simulations, we were doing case studies, we were doing groups like this where we would get on virtual with cameras and kind of have long discussions and break down the care of multiple patients and how we would triage, say, 3 or 4 patients that might come in and how we would help them. And so I think that in and of itself of how Nightingale kind of took the time to not only cover their P's and Q's with the majority of the states, but also with some of those really hard states where it is to get licensed and to have that breakdown so that it wasn't like, well, hold on, let's see what were they doing during these simulation hours. It more so was just like all right, cool. He hit that mark and was able to, prove that he was able to do what was done. And I think the other side of it was, when I went to take that NCLEX, a lot of the programs that Nightingale offered were very advanced for that NCLEX. I feel like Nightingale was on top of its game with being prepared for what was coming with the new NCLEX and helping us to be prepared for what to expect during that NCLEX program.
Fantastic. Thanks so much for that, Michael. We're getting some questions coming in, and so I'll start addressing them because this is a good time, and one of them is relevant in particular for Kris, I think. So Roger Kemp is asking, Kris, is the software developed in-house? If you can shed some light on that, that would be greatly appreciated.
Yeah, that's a great question. And I would say that we work in a node-based platform that is like an authoring tool essentially that helps us build out um, customized experiences that we can then deploy to the students. And I'm all about trying to basically kind of create like a VR ecosystem that we can put our learners into, where they can go into different VR apps and experience the learning experiences in that way. And one of the things that I really love about the scenarios we're doing is getting to talk to an AI patient, right? So imagine you put on the headset and you're then in a virtual hospital. Sitting across from you is a patient, but that patient has a prompt, an AI prompt that my team creates that basically says like, what is the conflict here? What are the symptoms that we're trying to work through? And then we're able to create essentially a case that the learners get to go into, and they get to work with these virtual patients that will speak back to you and have emotion, have different tone, have their own thoughts and feelings that they can communicate to you. One example I like to give is like, imagine you go in and you're working with a patient, you're taking their name and date of birth, general vital signs, and then they start having a seizure. There's maybe is like a family member in there talking to you, and there's so much going on. And it's up to you as that nurse learner to figure out what to do in that situation. And I think it's that type of learning where you're like in it, talking to, like working through it, facing problems, that is really a memorable type of learning that is just going to stick, and you can take into the real world ideally.
Fantastic. That is amazing to hear. And actually, one of the questions that someone's messaged me on LinkedIn as a DM is exactly around the AI integration, and we haven't spoken too much about it. So thanks for bringing it up, Kris. And Michael, I'm not sure if you were around when the AI was integrated into no. Such is the state of emerging technology, right? We can't have it all at the cutting edge all the time, and there's always something new to be brought into the program. But it sounds like Nightingale has been constantly evolving this program. So Julie, when did you start integrating the AI system, and how has that been received overall?
Yeah, let's see. We integrated that about a year and a half ago when we brought Kris on, and we are getting lots of amazing feedback from the learners because, as Kris explained, the learners are going to get exactly what they ask for, right? So if they ask a question, AI is going to give them exactly what, right? It's not going to, I'm a babbler, so it's not going to continue to give maybe like hidden clues or hidden information that you could glean from. So I think it teaches learners how to ask the right questions at the time to get the information that they need to be able to then progress to the next step. We've gotten lots of comments with the end of course surveys. We've added some specific questions around their experience in VR. So we're tallying that data, and I believe, Kris, there's something like 24,000 impressions, or I can't remember. Yeah, I heard you and Nate talking the other day, so I'll let you kind of take a little bit. I'm going to bounce it over to Kris, Jeremy, for a second, so he can kind of talk a little bit more about that.
Yeah, I think it's around 20,000 impressions, or essentially that's VR scenarios ran over a 10-week period, over the first 10 weeks of this spring semester, right? And I think those numbers are just crazy to see for me, because if we're comparing this to last semester, which was just 3 months ago, it was maybe a quarter of that, right, Julie? It's like the growth and the scale that Nightingale is having from increasing the learners is amazing, and then also that, of course, is going to scale up the usage that we have. So I'm just super excited to see the usage numbers for like summer semester, fall semester, given this trend that we're going in right now.
Brilliant. And a question has come in from Laura. Are there any learning metrics that Nightingale was able to measure that were particularly helpful in persuading leadership and academic reviewers that VR is effective for nursing education? Maybe to you for that one, Julie.
Yeah, great question, Laura. Yes, we have a lot of internal data. I have presented with my coworker, Dr. Jeffrey Olson, who is the president of Nightingale College. We've done 2 presentations at the ITSEC conference, and have done 2 white papers that discuss our data. Happy to share those with anybody who wants to reach out to me via LinkedIn. If you're watching via YouTube, I'm sure that my email address is out there somewhere. And those were initial data around. We use HESI as our summative exam. Summative exams. So we were looking at specific HESI components: clinical judgment, clinical reasoning, and nursing skills. We were pulling out that specific data. Going forward, we realized an opportunity when we had a little bit of motion sickness as a communicable disease here at Nightingale, and a lot of learners struggled with that, and so they wanted to do the scenarios in the 2D environment. So we decided to make some lemonade, right? And we started comparing the 2. So when learners experienced the same scenarios immersively instead of on a flat screen, they reached mastery faster with fewer attempts and a stronger performance. Additionally, and I'm super proud of this statistics, is that this approach didn't widen any gaps. So when outcomes were disaggregated by race and income, prior preparation, nearly every group performed as well or better in the immersive environment. So some of the largest gains have occurred in learners who are historically most at risk. So designing for practice has also meant, in our case, designing for equity. And so we're currently in the process of collecting more data. Like I said, we have the 2 papers that were done for the ITSEC conference, and I am working on a 3rd that will be, well, I shouldn't say me. our group is working on a third paper, and we'll begin it to submit for a peer-reviewed journal. But I'm always happy to share the different metrics. We recognize that there's some limitations to some of these metrics. We deal with the data that we had, but we've basically been looking at our internal data around this this initiative. And I believe that with an N of 10,000 going forward, we should be able to definitely have some statistically significant data to share soon.
That is incredibly exciting. And thank you, Julie and Kris, Michael, everyone at Nightingale who's contributing to these studies in different ways, because ultimately, at the end of the day, we want or we need more and more data as much as possible to help convince stakeholders of the value of this technology. Because yes, we can see the value is there. We can get anecdotal evidence. We can gather all of this material, but the gold standard really is the academically rigorous study and data that comes with a large population scale that you're looking at right now. So I think that's fantastic. Michael, we'll jump to you very quickly, and then we'll take a last question and wrap things up. So do you think, Michael, that virtual reality has a viable future in nursing education, or is this a bit of a fad technology from your perspective that is a one-hit wonder, a novelty type situation?
I truly think that it's the next step. Now, I don't think that like multiple years down the road that this is going to be like the constant use, but I do think that it is the next step. I mean, you look at surgeons are doing something very similar where they're using very tool-based games or systems to kind of practice with surgery. There's other career professions use a very similar model where they're practicing and using all of these different softwares to try and make things work, whether it be with physics or with chemistry and things like that. And so I think that this is a very safe way for nurses to grow and kind of hone their nursing skills without putting patients and the reputation of the facility they're at, or their own nurse putting their own reputations at risk, because they're able to guess and check and try and learn and kind of try different approaches. Like Julie was saying, is like you can ask one question, but there might be a better question that you could ask, and kind of practicing and trying again. And that's one thing that I really liked about going through the program, was I was able to retake the simulations multiple times, and try and get higher scores, or try and unlock different information that maybe wasn't told to me during the original one. But I also think with nursing kind of bridging, and just general health bridging into telehealth, a more virtual based healthcare system, I think that virtual reality is going to play a huge role in that telehealth. I mean, we have when I was in California, there was a lot of these hubs kind of popping up where there wasn't an actual provider there, but it was a virtual hub where you had a nurse and you had a medical assistant, and then they'd go in and they'd kind of assess the patient, and then the provider would come up on the camera and kind of direct the nurse on how to do things, and kind of gather information for that provider. So I do think that VR is the next step, and I think that it will be vital for every program to have something very similar to it.
As the end user of this VR AI application, Michael, that is great to hear. We are nearly at time. We've only got a minute left, so I'm going to try and squeeze in one last question and then we'll wrap up. So Harsh, thank you very much for this. What were some of the biggest or stubborn challenges which Nightingale faced while implementing this sort of infrastructure at such a scale? So maybe I'll jump to you quickly, Kris, if you want to take that one.
Yeah, I'll keep it short. So like from a high level, we can think about the most generic problems, which is just like learners getting stuck, whether that's from a technical issue, like on the VR platform, or it's because of a design issue that they're not getting progressed forward. So one design question I'm always tasking my team is, how do we ensure progression and ensure that the learner is always moving forward, which is, long story short, via like a hints system that we're designing, always giving them hints, always guiding them forward. And then if we dive a little deeper, it's on a assessment and a data side of like, how are the learners really doing? Julie could probably talk about this better than I am, but like, what are we learning or what are we taking away from the learners, like skills and competencies, right? When I first started out, we're using multiple choice questions to kind of do that. But now with the AI boom, we've shifted towards our data team reviewing transcripts and tagging different parts of the scenarios with different competency skills and then tracking those skills over time, right? So I think it's really leveraging the AI boom and what's going on there to help us with the existing challenges that we have and just kind of collaborating across different teams there to make it work and keep it all accessible.
That is a fantastic message to end on. The convergence of artificial intelligence and virtual reality is where the true value lies, not as most organizations see it, where it's all eggs in one basket and an inability to focus on more than one technology at a time. So it has been a real pleasure. Thank you, Julie, Kris, Michael. Is there any message you'd like to leave our audience with? Any contact details, any other information? Feel free to mention it now. Julie, over to you first.
Sure. Just in case anybody wants to reach out to me, my email address is jkolde at nightingale.edu. I think we're in a space where just call to action for our accrediting bodies and state boards of nursing to really look at the use and the outcomes that we're achieving with VR and making it equitable for everyone to use throughout nursing programs around the country. I think that would be the biggest next step that we could achieve.
Agreed. Thank you, Julie. Kris?
Yeah, my contact, you could find me on LinkedIn. It's my name here. And then email is khsu, my last name, at nightingale.edu. Happy to connect, happy to chat about anything. My one-liner takeaway is to continue collaborating across different fields, interdisciplinary fields, which I think has just helped me get to the point where I am today, being able to pull from immersive tech, education, storytelling, and this convergence of these three fields. And chatting with people is the number one way to do that, in my opinion. So let's keep talking. Let's connect.
Thanks, Kris. Michael, over to you for the last word.
Yeah. I mean, if you want to talk to me, my stuff is on LinkedIn as well. But I think as an RN and as somebody who has gone through the program and as somebody who continues to seek for more education, I think making the education easier and more palatable for the learner, especially as we get more diverse into, different diagnoses of autism and things like that, where people are having struggles with kind of face-to-face communications at first. I think things like virtual reality and AI can really help bridge that gap and help some learners grow to a better level and prepare them for not only nursing, but every field that is out there. So if there is an education system that you are a part of that does not use virtual reality, I would look into how it can be added to it. I'm a strong advocate for technology and for virtual reality specifically.
Thank you so much, Michael. Thank you, Julie, Kris, Michael, and to all of our audience. We had many who I hadn't mentioned yet, but we've got Chris Booker from Nottingham in the UK. We've got Haval from Erbil in Iraq. We've got others from Los Angeles, Laura. We've got loads of people from many different places around the world that have joined us today. So it has been a real pleasure hosting you. And it has been absolutely delightful to hear about this epic implementation of emerging technology, specifically virtual reality and artificial intelligence, from the Nightingale team and from Michael, a registered nurse who has who's actually used the technology as an end user. So thank you all. Thank you to the audience, and we'll see you next time. Bye-bye now.